Okay, ma'am. Yes, starting now.
Yeah.
So, very good evening, doctors. I am Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's webinar. So, the topic for today's webinar is breastfeeding and COVID-19, nutrition to immunity. So, I welcome all the participants and I request them to post their queries in the chat box so that we can have a short discussion with the speaker at the end of this presentation. So now it's time to invite our speaker for the day, Professor Dr. T.K. Shaanthy Gunasingh ma'am. Madam is a consultant in obstetrics and gynecology and past president OXY, former director and superintendent Institute of Obstetrics and Gynecology Chennai, former director and superintendent ISO KGH Triplicate in Chennai, former HOD and of OG department KMC, served as a project director Center of Excellence for Tubal Microsurgery in KMC for 6 years. And Madam was the past president, Women's Doctors Association, Tamil Nadu, executive committee member, Chennai Menopause Society, master trainer for BEM ONGC and tubal microsurgery, lactation management and adolescent health. Madam has received Dr. A.L. Mudalia Traveling Fellowship in 1993. Madam is also the well-known invited speaker at national and state level conference. Madam has also participated in various radio talks and television shows. So with this short introduction, ma'am, I welcome you, ma'am, and hand over the session to you for your presentation, ma'am.
Thank you very much, Dr. Stalin, for your kind introduction. I thank Shield Healthcare for having given me an opportunity to talk on breastfeeding and COVID-19 when we are celebrating the Breastfeeding Week. Can I start, Dr. Stalin?
Yes, ma'am.
Yeah. So the topic given to me is breastfeeding and COVID-19 from nutrition to So breastfeeding is the cornerstone of infant and young child survival, nutrition and development, and maternal health. It helps to defend against infections, prevent allergies, and protect against a number of chronic conditions. The WHO recommends exclusive breastfeeding for the first 6 months of life, followed by continued breastfeeding with appropriate complementary foods for up to 2 years and beyond. Early and uninterrupted skin-to-skin contact, rooming in, and kangaroo mother care also significantly improve neonatal survival and reduce morbidity and are recommended by WHO. So it's not only breastfeeding, it is also the early and uninterrupted skin-to-skin contact. So we know that initiation of breastfeeding should be immediately after birth, be it vaginal delivery or operative vaginal delivery or C-section, and preferably within the first hour of life. And exclusive breastfeeding, we all know that the infant receives breast milk only without any additional food or drink, not even water. And breastfeeding should be on demand. That is, the child's demand, as often as the child wants, day and night, and no use of bottles, teats, or pacifiers. So this clearly tells us about the good things what the breast milk has to offer for the baby. It gives antibodies, hormones, antivirus, anti-allergy, anti-parasitic. It gives growth factors, enzymes, minerals, vitamins, fat, carbohydrate, protein, water, and so on and so forth. And it has ultimately beneficial effect on all systems, be it ears, eyes, IQ, endocrine system, mouth, respiratory system, then kidneys, appendix, urinary tract, and ultimately the immune system. So the child will respond better to vaccination, and human milk helps to mature immune system and decrease risk of childhood cancer. So the health benefits for infants are innumerable. And scaling up breastfeeding could save the lives of more than 820,000 children under age of 5. And IQ increase we have seen already in lower infectious morbidity. And the most important thing with obesity being being very rampant, longer periods of breastfeeding are associated with a reduction in a child's risk of overweight or obesity. So ultimately what happens is breastfeeding provides immunological protection while the infant's immune system is maturing. It's not only for the baby, but also for the mother. The breastfeeding could also prevent the death of 20,000 women a year from breast cancer. And it could also improve birth spacing and associated with the reduction in a woman's risk of diabetes. This is very, very important since India is the diabetic capital of the world. So that will have huge impact not only on the woman, but also on the resources of the country. And breastfeeding might reduce rates of ovarian cancer. So it really helps a great deal. And should we have to only breastfeed directly from the milk, from the breast, or can it be stored and then fed? So human milk can be stored at room temperature for 6 hours, and express milk can be stored in insulated cooler bag with ice packs for about 24 hours, and it can be stored in the refrigerator for about 5 days at about 40 degrees Fahrenheit. And it can be kept in the freezer compartment of a fridge for up to 2 weeks at 0 to 5 degrees Fahrenheit, and in a deep freezer for about even 3 to 12 months. So now our country is still facing the COVID pandemic, and we seem to have increasing cases day by day. So what about breastfeeding is such a pandemic? So breast milk is the best source of nutrition for infants and protects them against illnesses. And with the limited data available so far, transmission of COVID-19 through breast milk and breastfeeding has not been detected. WHO guidance is very, very clear. Mothers should continue breastfeeding even when suspected or confirmed to have COVID. And it's very important to maintain the hygiene. Mothers should always wash hands with soap and water at critical times, including before and after breastfeeding and contact with the infant. And it's very important to use face masks when feeding or caring for the baby. And especially if the mother has respiratory symptoms, use a face mask if available. Locally available or adaptive face mask can be used as an alternative. And it is also important to routinely clean surfaces around the home that the mother has been in contact with using soap and water if the mother has or is thought to have COVID-19. Mother and infant, that proximity should be maintained, but then this diet should maintain physical distancing from other people, at least 1 meter where possible. And we know that, like for other COVID patients, we tell them to try to avoid touching their face, and mother should wash hands if she touches her face. And close early contact is still recommended by WHO, UNICEF, and various other organizations. Skin to skin contact, rooming in with necessary respiratory and hand hygiene. If the mother is very sick with COVID-19, then breast milk can be expressed either with hand or using a pump. So we have to hand wash with soap and water before expression of breast milk. And assistance with latching, that should be done by a attendant. And breast milk should be fed to the child using a clean cup and spoon, and it should preferably be fed by a person who has no signs or symptoms of illnesses. If donor milk is available, in Tamil Nadu, we have a huge chain of human donor milk. So if human donor milk is available, then appropriate screening and pasteurization services are available. It can be given. And if the mother was very sick and she was not able to feed, then when she recovers, we can support her with relactation. So this is for a newborn. But then if a child is under 6 months with the mother having symptoms of COVID, then we have to continue to breastfeed the child on demand, then use hand hygiene measures, and expression and feeding feeding of express breast milk following appropriate hygiene measures can be done. Avoid going to public places to prevent COVID-19 from passing on to others. And it is very, very important to limit the number of caregivers feeding and caring for the infants. If the baby is over 6 months, the same things have to be followed. Continue to breastfeed the baby, age appropriate, adequate, safe, complementary feeding from 6 months, cup and spoon feeding, use soap for hand washing before and after feeding. Try to avoid going to public places to prevent COVID-19 from being passed on to others. Avoid drinks or food with a low nutritional value, such as sugar-sweetened beverages, foods high in sugar, salt, and trans fats. So we have this paper published in International Breastfeeding Journal by Lube et al. So this is actually, they have given this is a literature review for clinical practice for breastfeeding during the COVID-19 pandemic. So for all infants, it's very important to avoid separation of mother and infant diet, and we have to follow infection control precautions. So if the mother is healthy or asymptomatic, no problem, initiate and continue breastfeeding. If the mother is suspected of having COVID or has been exposed or is symptomatic, but she is well enough, then also we initiate and continue breastfeeding. And we have to follow infection control protocols with specific attention to droplet protection. And then if the baby is an infant of a mother who has tested positive for COVID-19, then also we have to continue to breastfeed. Sorry. So a positive mother who is with mild symptoms, then we isolate the mother and infant diet at home. So always mother and child go together, and she has to wear a mask during feeding. But if the mother is positive with severe symptoms and the mother needs to be hospitalized, then also we hospitalize the mother and infant diet together at home, together in the hospital. Then there should be a discussion between neonatologists and families about the risk benefit to individualize infant care in the case of infants requiring neonatal care. Sometimes temporary separation may be needed in case of mothers who need medical care in a hospital. If they can, or an attendant can help to express breast milk, then the baby can be fed with that. So if the infant of mother who tests positive for COVID-19, then breast milk can be expressed and fed with clean cup or spoon. And it's very important that the breast milk can be decanted from her container into a clean container held by a healthy person to prevent transmission via the container's surfaces. So repeatedly, we have to reiterate that the mother has to wear a mask during expression, and a healthy person has to feed the expressed breast milk to the baby. And in case of separation, it is very important to give psychosocial support, not only for the mother, but also for the parents. So a positive mother, so when expression of breast milk is being done, we have to follow all infection prevention measures. And it's very important not to share equipment for breast milk expressing. And all the equipment should be rinsed in clean, cold running water before sterilizing it. And we have to wipe down the bottles with a virucidal agent of 1 in 10 diluted bleach. And before that, it also has to be washed with hot soapy water with domestic detergent under running water and dry with a paper towel. After that, it has to be sterilized. So we know about the personal hygiene which has to be followed. Washing hands often for 20 seconds with soap and water, or using alcohol-based hand rub, covering mouth and nose with a disposable tissue or elbow when coughing or sneezing. Then very important to maintain social distancing with others. So that is very, very important. And do not allow anyone to kiss the infant, and ask them to disinfect their hands when they come into the house or plan to touch the infant. And do not allow anyone who is ill to visit the mother and infant. And it is very important to reiterate on the mother that they have to use the self-isolation time to bond with the infant at home. So these are the frequently asked questions for on breastfeeding and COVID-19 for healthcare workers, which has been published by WHO. So following delivery, should the baby still be immediately placed skin to skin and breastfed if the mother is confirmed or suspected to have COVID-19? So we are very clear that the mother has to be breastfed. But what about skin to skin contact? So immediate and continued skin to skin care, including kangaroo mouth mother care, improves thermal regulation of newborns and offers several other physiological outcomes. So it's very, very important to have close skin to skin contact. And if a mother is confirmed or suspected to have COVID-19, so should she continue breastfeeding? This we have understood by now, that it is very, very important, as it reduces neonatal, infant and child mortality. The transmission of COVID-19 through breast milk and breastfeeding has not been detected. So what are the hygiene recommendations for a breastfeeding mother confirms or suspected to have COVID-19. Wash hands frequently with soap and water or alcohol-based hand rubs. Wear a medical mask. Replace masks as soon as they become damp, and dispose of the mask also immediately. Not to reuse a mask, not to touch the front of the mask, but untie it from behind. And of course, the coughing etiquette, sneeze or cough into a tissue, and regularly clean and disinfect services. So here, in certain places, a mother confirmed or suspected to have COVID-19 does not have a medical face mask. Can she still breastfeed? WHO emphatically states that breastfeeding unquestionably reduces neonatal and infant mortality and provides numerous lifelong health and brain development advantages to the infant or child. So even if this is not possible, breastfeeding should be continued. And other infection prevention measures like washing hands, cleaning surfaces, sneezing or coughing into tissue are also important. Non-medical masks have not been evaluated, like homemade or cloth masks. So it's not possible to make a recommendation for or against the use. And is it necessary for a mother with confirmed suspected COVID-19 to wash her breast before she breastfeeds directly or before expressing a breast milk? So if a mother is confirmed or suspected to have COVID-19 and has just coughed over her exposed breast or chest, then she should gently wash the breast with soap and warm water for at least 20 seconds prior to feeding or expressing breast milk. It is not necessary to wash the breast before every breastfeed or prior to expressing milk. So it's very, very important that express breast milk can be given if a woman is really very sick. And we can also consider donor human milk if the mother is unable to express milk and milk is available from a human milk bank. So this can be fed to the baby while the mother is recovering. And what about wet nursing? So if expressing breast milk or donor human milk are not feasible or available, then we can consider wet nursing and infant formula milk with measures to ensure that it is feasible, correctly prepared, safe and sustainable only as a last resort. So this is a decision tree which has been nicely given by WHO. So if the mother is suspected or confirmed with COVID-19, then if she is not positive, no problem at all. We have to support the mother to breastfeed. If she is positive, COVID-19 positive, then we have to see whether she is well enough to breastfeed. If she is well enough, she wears a medical mask, follows cough etiquette practices, and then she continues breastfeeding. But then if she is not well enough, then probably breast milk can be expressed, maybe with help or even with the means of a pump, and it can be fed to the baby. And she can revert to direct breastfeeding when she is well enough. But then if she is not able to express the milk, then probably human milk is available in a donor human blood bank, a human milk bank, then that can be fed to the baby until the mother recovers. But then if we do not have, the mother is not able to breastfeed, no human milk is also available, there is no human milk bank, then if wet nursing is culturally acceptable, then it can be carried out. But then if all these measures are not possible, and then only then can we feed infant formula milk to the baby until the mother recovers. After that, if she is willing to feed after recovery, then we can help her to relactate, or if not, continue alternative measures of feeding the baby. So this is a nice decision tree which really helps us. UNICEF also clearly states that a mother should follow 3 Ws: wear a mask during feeding, wash hands with soap and water before and after touching the baby, wipe and disinfect surfaces regularly, and use a cup and spoon to feed babies with express breast milk when too sick to breastfeed, and formula feeding only as a last resort, and that too, and extra care should be taken while formula feeding. What about COVID-19 vaccines while breastfeeding? So COVID-19 vaccines are recommended for breastfeeding women, and none of these vaccine ingredients could pass on to the baby through breast milk. And so a woman should not stop breastfeeding just because she's getting vaccinated against COVID. And we also have this myth is very much entrenched in the minds of a lot of people that lactating women should not get vaccinated. On the contrary, COVID-19 vaccination is recommended for all lactating women, rather even to a pregnant woman. And which COVID vaccine in pregnancy is safe in pregnancy and during lactation? All vaccines, COVID vaccines which are available, Covishield, Covaxin, Sputnik 5, Moderna vaccines are safe for pregnant women and lactating women. So what about the antibodies in the breast milk of a maternal woman, of a woman with COVID-19? So the most important thing is when a woman contracts COVID-19, she produces antibodies which passes on to the baby and protects the newborn. So now we see that the cases are rising, and the number of pregnant women and neonates with COVID-19 is also on the rise. And this article has been published in JAMA. So this is rather a research letter, SARS-CoV-2 specific antibodies in breast milk after COVID-19 vaccination of breastfeeding women. So this was actually conducted in Israel, which initiated a national vaccination program against COVID-19 as early as December 2020. So no mother or infant experienced any serious adverse event during the study period, and it was noted that IgA levels also started rising and IgG levels also started rising, especially 3 weeks after vaccination. And so it's very, very important to vaccinate a lactating woman. So to conclude, breastfeeding is the best protective measure available for healthy and at-risk infants and their mothers during the COVID-19 pandemic. Breastfeeding should not be interrupted. The mother-infant diet should not be separated. Skin-to-skin contact should not be discontinued. While ensuring normality as far as possible, general infection control measures should be in place and adhered to very strictly. And in exposed or infected mothers, additional droplet protection should be taken by the mother by wearing a surgical face mask when handling and feeding her infant. When mothers are too ill to breastfeed, they should still be supported to express their milk, and the infant should be fed by a healthy individual. Donor milk and wet nursing can be done. Formula feeding should be the last option, and breastfed infants have an advantage receiving additional protection against SARS-CoV-2. So thank you very much for the opportunity and the patient here.
Thank you, ma'am. Thank you very much for the tips and wonderful presentation, ma'am. Ma'am, let me wait for 1 or 2 minutes for the participants to post their queries, ma'am. If there is any queries, then I'll read it for you, ma'am. Ma'am, one of your classmate, Dr. Damodaran has joined this session, ma'am.
Oh, from Gulf.
Yes, ma'am. Sir has joined and he has greeted you, ma'am.
Thank you. Thank you.
Ma'am, what will be the safety profile of a woman who has infected with COVID and is taking some antiviral drugs or any immunomodulators, whether it will affect the child while taking this breastfeeding?
See, when a woman is really very sick and when they are on all these drugs, still express breast milk has been advocated because these drugs have been found to be safe. So it is very important to try to express breast milk as much as possible. If the woman is critically ill, then that is a different matter.
Fine, ma'am. Ma'am, there is no other questions in the chat box, ma'am.
Yeah.
So if you
Thank
all
you
are,
very
yeah,
much.
ma'am. Thank you, ma'am. Thank you very much for your for accepting our invitation in the short period of time, and you have delivered a very good, wonderful talk, ma'am. So I would like to thank all the participants for their active participation, and I thank our team for making this webinar possible, ma'am. Thank you very much, ma'am.
Thank you. Thank you.
Thank you very much, ma'am.